I spent some time in Brazil as well. I saw very different things. Somehow this time made me decide for being an orthodontist.
Today, we're joined by Dr. Nuno Sosa Diaz, an orthodontist, innovator, and international speaker. He is an active member of the European Academy of Aesthetic Dentistry, has lectured in over 20 countries, and leads his private clinic Identify in Portugal. With a passion for blending science, aesthetics, and patient care, Dr. Nuno brings a truly global perspective on modern orthodontics.
So when I finished the program and I went back to my country, I had in mind just being more into adult treatment, not a clinic full of kids.
A lot of people think that orthodontics are only for kids. It's not true, and there's so much of ortho that helps out in even implant treatment, perio, and especially pearls.
The orthodontic language is different from dentist language. So when you talk, there is a miscommunication between both of them.
How did you end up working in so many places in different countries and seeing this adult patients, which are hard because ortho needs you to continuously monitor and go on?
I think.
Welcome, Dr. Nuno. It's been such a long time and such an honor to have you back in Malaysia. So this is a special time where we have this podcast going and we're talking about optimism in dentistry. But before we start, I would really like to let the audience know and get to know you. Who are you and what do you do and what's your background?
Good morning. It's a pleasure for me to be back in Malaysia. For those that don't know me, I'm Nuno Sosa Diaz. I'm a Portuguese citizen. I'm a dentist and with special interest in orthodontics. So if I have to summarize quickly my background, I did my dental education in Portugal. During my dental education, I spent some time in Brazil as well.
Wow.
So it was a critical moment of my education because I saw very different things. I spent there like half a year. And somehow this time made me decide for being an orthodontist. So when I finished, So when I finished my my graduate program, I considered to become an orthodontist. So at that time, I had some options on the table and I checked the best university program. So I moved to Tel Aviv to study in Tel Aviv University. So I was there for almost 4 years. And after I came back to Portugal and I started my working life.
Your working life.
Yes.
I think you're more than an orthodontist. I've seen your impressive career and journey where what you've done with orthodontics and how you have brought orthodontics to aesthetic dentistry and the people you work with. Do you mind sharing a little bit about that and what made you go into adult orthodontics more than kids orthodontics?
Yeah, well, when I was in my orthodontic program, I had a strong education in lingual orthodontics. That was by the time considered what we say as an adult orthodontics. So when I finished the program and I went back to my country to start working as an orthodontist, I had in mind just being more into adult treatment. Okay. By that time, I luckily got some invitations to work in other countries with some other specialists. Even though I was quite young, I didn't know what to expect. So I started from the early beginning to face this type of orthodontics, not a clinic full of kids, as it's happening many times.
Yes.
So I had this momentum happening and I started working with different orthodontists. Orthodontists, I mean dentists. And my orthodontic kind of treatment plan, decision started to spread in a different way. Not as an orthodontist treating kids, but more focus on interdisciplinary treatment.
How did you get into, I mean, you work with famous people like Galip Gurel and so many more that I can't name, Dr. Nazari and all. How did you end up working in so many places in different countries and seeing all these adult patients, which are hard because ortho needs you to continuously monitor and go on.
Yeah. I think it was the fact that I didn't follow the normal trace as an orthodontist, having an orthodontic clinic just treating kids, made me to find out about another world. That I think the majority of the orthodontists, they are not really exposed to this world.
Yes.
So I think this is what happened. I didn't do it on purpose. And considering that I started working with other specialists, I think they started to share between them the advantages that they found in working with an orthodontist. I also think that they were not really aware of what orthodontics could bring to their own treatments.
That's true.
So I would say that I was lucky I was in the right moment with the right people that helped me. But I also succeeded with this environment because many of the orthodontists, they just follow a different route, treating kids. And it's not that I'm more skilled or less, it's the fact that I was like directed to this kind of route. So this is what happened to me. And after working with a prosthodontist that can improve his work because of my orthodontic treatment, all the others can see, wow, I can have the same. So I think this was the sequence of events that happened to me.
Yeah. No, but I think for the young ones, a lot of people, or even the public, a lot of people think that orthodontics are only on tooth movement or moving teeth are only for kids. And it's not true. And there's so much of ortho that helps out in even implant treatment, which is what we are doing now. And also perio and also, especially pros. So I think that is what we are lacking. And treating adults, are they very different from treating kids, in terms of the orthodontics principles? Do you find that it's different?
Yes, I think the main problem here is the language. Because the orthodontic language is different from dentist language. So when you train for so many years as an orthodontist, you are trained to talk with another orthodontist.
Yes.
You are not trained to talk with a dentist or other specialties.
Yes.
So when you talk, there is a miscommunication between both of them, that they think that both of them, they don't understand what they are saying. So the prosthodontist or the periodontist, they request impossible things to the orthodontist, and the orthodontist talks a language that they don't understand.
Yes.
So I think it's a question of communication. And this, for a young orthodontist or for a young dentist that wants to become an orthodontist, he wants to understand this path. Another problem is that orthodontics is very intense. So there is no time to know about dentistry and know about orthodontics. But nowadays, I think it's really mandatory to have at least standard basic knowledge in each of the specialties.
That's true.
And to understand what is lacking. So only if you understand that, you really are able to help as an orthodontist.
I think that is a key message, for a lot of people, for even very experienced dentists. We are brought up in different way, all because of our education system, and we are kept separate in all different specialties, and we're not doing better patient care. In actual fact, it's because we can't communicate with each other, like you say, as well.
I think it's about communication so much, because even in the university environment, you have all the departments there. They cannot communicate properly. All of them, they want to do their own way. There is lack of flexibility.
Yes.
We need to understand that the specialties are different. They complement each other in many ways. This is what is lacking. This teaching is really lacking. I learned that by myself with errors and with the mistakes. And even nowadays, I see that is not a complete, job task, because it's every time that we talk with a different specialist, you understand that they need a different type of language to understand what you say, and vice versa.
Yeah, that's true. That's true. I think ortho is one of those fields that is so way out of what normal dentistry is. And unfortunately, in the undergrad program, we don't get to learn much about it. And I think that's something nowadays we should be thinking about. And I think we don't practice in a world where it's a solo practice anymore.
Yes, I think regarding the education, the idea of not getting a lot of knowledge in orthodontics in a graduate program, I understand why. It's complex and there is no time for everything, but it's not mandatory. But it's mandatory to explain what is possible. This is what is lacking. They find this excuse, orthodontics is another specialty, so we are not having time to cover everything. There is no need to cover everything.
Yes.
But you need to teach a young student, a young dentist, what tooth movement can add to all the rest. Otherwise, they will end the graduation thinking about single tooth dentistry. They just think patient comes with a problem, they treat a tooth, that's it.
That's true.
And in 2025, this is no more gold standard to follow.
I think you are absolutely right. We no longer can treat teeth just as a single tooth, but actually in whole, as occlusion and everything needs to come into play. Even nowadays, people are placing implants as well, non-stop, and just treating it as a single implant, but it's not a single implant. It's the patient's mouth. Do you think over the last 15, 20 years, I think the biggest change in ortho is clear aligners. And it has opened up this whole field of orthodontics to not just the specialists, but also to the general practitioners, and everybody jumps in. Oh, it's more for aesthetic reasons because patients want straight teeth.
It's a very complicated time now. I tell you why. First of all, we are developing in a way that cases are becoming more complex because of bad dentistry, because of the excess of implants, because of many things. So this requests high top orthodontists or people that work in an interdisciplinary manner. And with the tools that are coming to the market, this becomes more difficult. So it's two things happening. We are bringing orthodontics to everyone as an easy tool. But at the same time, dentistry is becoming more difficult because the cases are becoming more complex. People want to have teeth longer. The dentistry is in some way adding complexity with wrong decisions. So these wrong decisions, sometimes they need very complex treatments. But at the same time, we are introducing an idea of everything is simple. So it's a combination.
It's our own fault too.
Yes, it's our fault, because what a normal case that needs orthodontic tooth movement to be a successful case was in the past done with brackets and could easily be done with aligners. Nowadays, because of the complexity that we are adding with the wrong decisions, aligners is not enough sometimes. So this is why these two worlds are going together, and it's becoming a challenging time.
Yeah, but I know you have solutions, so we have to find the solutions and make it available and still make it simple for everyone. So no, but that's interesting to know, because we all think that ortho is just ortho, and I don't think ortho is just ortho anymore in this day and age. And a lot of the companies make it sound as if it's ortho, but we're seeing all the complications in very young patients. They are, because they had their ortho done at 12, 13, they're coming back at 21 and 22, and they're having problems, can't bite, open bite, all of these issues. How do you think we can prevent that as a profession? And they've seen orthodontists, they've gotten the treatment the correct way. Well, supposedly.
If we have, considering what you are telling me, we go into the prevention discussion. And the prevention discussion, it's something that we can talk all day because it's super important. I think treating kids as with orthodontic treatment is necessary in the majority of them and is completely necessary. But the treatment never ends. The teeth continue moving.
As they grow.
It's part of aging. The bone, the jaws continue growing. So we need to keep a follow-up. We need to give attention after the treatment.
Yeah.
We should give the patients the idea that is a long life treatment. It's not just we do it, teeth are in a nice position, patient disappears for 5 years, the teeth moved somehow, and this is the fault of orthodontist. That is not very well done. It's not correct. So what I would say is, after finishing an orthodontic treatment or any other dental treatment, the maintenance in terms of follow-up, it's super important.
Cool.
This is
This is lacking though.
This is lacking because of the
lacking.
financials. It's very, at least in Europe, it's very difficult to charge a patient to give oral hygiene instructions. That is the basic things for all the specialties.
Yes. Yes.
Because if you think properly, all the problems, the majority of the problems in dentistry, they come from bacteria.
Yes.
The perio problems. How can you lose a tooth?
Yeah.
You have 3 ways. Or you lose the tooth, you lose the support of the tooth, a perio problem that comes from bacteria. Or you have a carie, a decay that is coming from bacteria. Or you have a trauma that you cannot avoid. Okay, so basically 2 of the 3 main reasons to lose a tooth, they are related to oral hygiene and the prevention.
Yes.
As long as we control this, we prolong the life cycle of teeth. So this is super important. And about orthodontics, because the goal is to straighten the teeth, let's say, the teeth are moving because everything is dynamic. And this idea of, is it stable? Is it stable? There is no stability. It's maintainability. As Birte Melson once said. So we have to educate our patients for them to know what to expect.
Yeah.
We have to promise real things, not to promise unreal things. To say, you come, you do, that's it. You don't need even to brush your teeth. Everyone is perfect for life. They have this idea because they come and say, it's going to be stable. If not, I prefer to take all the teeth and put implants.
Oh, no.
They come with this.
Yeah.
This is our responsibility to educate them.
Yeah.
So,
no, I think you brought up a very important point that most people don't want to talk about, that even in orthodontics, there's a need for maintenance. And the maintenance is to check whether the teeth has moved, whether occlusion has shifted, all of that stuff that we don't do. Nobody does.
Yes.
Not even the GPs that, normally does all the maintenance would be looking at. They don't even check the bite, and sometimes they don't even check perio. So
this is super important because we finish an orthodontic treatment. Everything is according to what we planned. We have canine guidance, incisal guidance, teeth in a normal occlusion. Everything is okay. But if the patient starts to have a carie on the right side, on the posterior tooth, starts to avoid biting on that side because it's painful. And it starts to unbalance all the stomatognatic system. And the problems will start because this tooth got a treatment. The dentist was not so good. The restoration is a bit high. He avoids to bite there. He loses this tooth. The contralateral tooth starts to erupt. And suddenly it's a mess because the main message here is to continue to search for dental service in a proper way, in a maintenance way. For ortho and for all the other specialties, the same. For implants, the same. For perio, for restorative.
Yes.
Even if no problem is found, we have to keep track on the patient.
No, I like this concept because most of the time this is not being taught in ortho. The ortho goes like, I'm done. That's it. It's your problem.
It's not, it cannot be. But this comes, I think, also because of financials. Because, if I have a full agenda and I have to book a time for a patient that I already treated 5 years ago just to check him and to see if everything is properly okay, or I have to put a new patient that will give me a lot of money. This is the thing and it's hard for us to charge the patient that we are actually checking the 5 years.
Yeah,
it's the
right.
same when a patient comes and you just give oral hygiene instructions. How much can you charge for your time?
True.
But it's the most important part.
Yeah.
The patient will not understand as long as you don't do anything clinical in the mouth. And we need to find a way to change that.
Yeah. I mean, we have to be able to educate the patient, and that's why we're doing this podcast, to ensure that we send out the message, not just to dentists, but also to the public, that ortho doesn't finish on the day you take out your braces or you stop your aligners. It just is more than that. I think anything in life, the funny thing is people buy a car and they will send it back for maintenance, but they don't want to maintain their teeth and they don't want to spend money. And I can never understand that part. But it took many years for perio, for people to realize that they need to come back for maintenance every 6 months. So if we are able to do that for perio and for oral health, why are we not doing that for ortho? And be it training dentists more to be able to look at occlusion and check that the teeth have not moved, or be it looking at maintenance in ortho practice in a different way.
Sometimes we have situations that we see the teeth moved, but we also need to be reasonable and to talk with the patient to say, is this movement something that is disturbing you? Does it really justify to go through an orthodontic treatment again? Is it something relevant? Is it part of normality? Because all this comes from a discussion between patient and doctor.
I see.
Let's say I have this small space open again, but it's a 0.2 millimeters. Does it make sense to put brackets, to use aligners to close that, and maybe when we finish it will open again because there is a dental size discrepancy? Can we propose maybe a restoration to fix this problem? So we need to be broad-minded, to give options, to find patients a solution for patients. Maybe it's a patient that is saying, this is disturbing me every morning, I cannot stand it. Maybe it's a patient that was not even aware. So we need to differentiate the patient's behavior, the patient needs, and this is the doctor's psychology work, the one-to-one. This is how I see it.
No, I think that's so important, because you come from the patient perspective all the time, and sometimes in dentistry we only talk about treatment perspective all the time, and I think we get sucked up in the treatment protocols. We forget about what the patient really wants or what the patient needs to go through. And ortho is one huge subject, because it's not easy to convince adults to do ortho.
You know, I always try to do this exercise. I look at the patient, I say, how can I help this person? It's not how can I fix his teeth? And helping a person sometimes is saying, I'm sorry, but you are not a person for orthodontic treatment.
That's true.
It depends, because sometimes I see it's not about convincing the patient, because sometimes I see I can convince this patient to do whatever I want. But I need to explain him what could be the value of what I'm giving to him.
Yes.
Because the value comes with a cost and the discomfort. So all this together.
And also a bit of risk every time.
Risk all the time. We do risky things.
Yes, we do.
Very risky things. Every time the patient sits on the dental chair, there is a risk.
Yes.
We have to remember that.
I don't think people realize it.
Yes, it's really something that we have to think. And when we propose something, is because we internally find that there is really a need. Okay, so one of the answers that I always try to answer in the first appointment, when I see, I need to see how in percentage in my brain, what is this patient, what is the benefit of the orthodontic treatment here? So, because the benefit can be very small, and I need to explain him, I said, look, this small issue that you are telling me, it might need us to go through 2 years of treatment, and I'm not sure it will be exactly as you want. The difference that you will see might not justify the effort.
That's true.
So you need to know that. You understand? On other patients, I say, look, with 2 months, I know that the impact will be so big that you will be so happy. That I really recommend. We need to differentiate this. Not rush in your orthodontic treatment looking at the picture and that's it. We have to talk with the patient. to understand really deeply what is necessary.
I think that's the line that is so hard to teach, and that's the line that a lot of dentists don't want to look into, because it's either over treatment or under treatment. It's two directions.
Yes.
Yeah, but you are completely right. It's actually the patient, and if we can focus on the patient, I think that is the main thing.
Yes, it's an exercise that with time you get so experienced with that. The patient comes in the door and you know already how you can handle this, because and you feel good because you feel that you are serious with the patient.
Yes.
You go home and you say, today I told 3 patients that they should not get treatment. You give them the options, but they need to be aware of the effort that they will go through in order to achieve something that is probably not so visible or relevant.
Yeah.
And the opposite, some patients, they are not even aware. I said, look, whatever we do in the first 3 months, you will get such a difference that you will realize the value of what we are providing.
And I think that's a key message, because we, as dentists now, just too much of commercializations where you can just see teeth moving straight and then patients all want to jump onto it, or patients come nowadays to ask for ortho, right? And it's gotten to the extent that we even have non-qualified dentists placing brackets, giving aligners. Aligners are given straight to patients without even seeing a dentist, because everybody is in fashion for the younger generation, and that's hard to beat. How do we even stop that?
It's very difficult to stop that, because all the dental industry, it's simplifying procedures in all the fields.
Yes.
In implants, they give a cookbook, a guide, color guide. You start with this bird, you put this one, you put this one, treatment is done. In orthodontics is the same. They target the general dentists, because general dentist is the major population. So the dental industry is pushing in this way. The orthodontists get upset, some of them, that they have this, let's say, fight, and it's not relevant because they are a minority.
Yes.
But the problem here is not if he's a dentist or an orthodontist, is to have, we need to give this feeling of the clinician more than the clinician, to provide a service that he is able to do a professional work.
Yeah.
So
do you think training is very important?
Yes, but not training in terms of skill set, hands skill set. With the digital is different training now.
Yes.
The training is in educating the new dentists to understand this, to know how to judge, to communicate, to select, to say, I'm a dentist, I do aligners, very nice, but I have a company that is helping me with the planning, very nice. Or this is not the case for me, I'm going to refer to someone better than me. This judgment is what we need to teach. Because if you come with this feeling, everything is for me, you will fail around the line. So this is what needs to change.
That's so critical. Critical. It's so hard to teach that. And hopefully this podcast is going to be able to teach some of this.
Teaching, it's something that should start in the first year of the university. I think the graduation program should change from the start. We should teach not when the student finished the studies that we are going to teach now, because you are going to work in a dental clinic. It should start from before. They should have this clear mind. What are they? Why are they in the dental school? What do they want to do? They want to make people happy. They want to provide a service that there is nothing better than to feel that you did something and the patient benefit from your treatment.
Yes.
The worst thing is you are doing something that you consider very advanced, and the patient doesn't understand and doesn't value.
And on top of that, cause more harm.
And
sometimes in some situations, and I think that's hard to teach.
And especially in orthodontics, because you see the patient every month. So you say, I don't want to see this patient anymore. You cannot do anything.
You cannot stop it. Right?
Yes.
No. We have to, definitely you are going to have to give a lecture on this, and then we're going to run a program that talks about empathy as well in orthodontics for patients. And I think it's like teaching a child. You want to teach the child empathy. I think
this is not just ortho. I would say I don't even like the word orthodontics for this topic. I think we can talk about tooth movement. I want to exclude the name ortho because the people have already a wrong perception about ortho. I think it's as a clinician.
Yes.
When you look to the patient, when you feel what you need to be achieving a final result together with the patient. Patient is part of the decision and the help for the success.
That's true.
If there is no help, there is no success. So what the young dentist or young students should know is how to team
Together.
with the lab, with the patient, sometimes with the patient's parents.
Yep.
Okay, that is very complicated because you want the young adolescent to use elastics to achieve the result you want, but the parents, they, for example, they are divorced and they don't communicate with each other. So you have a very important role because you need to go and to say, look, we need to achieve this. We need everyone to be together for this, things like that.
Yes.
So all these people are involved for the best final result. It's not just a technique anymore.
It's human resource management.
Yes, exactly. This is important discipline to learn from the start.
Yeah.
We learn this with mistake.
Yeah, that's true. We learn this through mistakes.
Through
managing
mistake.
people.
So
yeah.
This is for me the major change.
It's true. And also, how do you partner with people or be able to get reports? As a young dentist, you don't have a lot of knowledge sometimes, and you wish somebody's going to do something for you, and that's what we're working on, and hopefully we can share that.
In the future we might be sharing something, but the young dentists, they rely on technology to help, and I hope this next years something is coming to the market to help not just the young dentists but everyone to take the best, let's say, technical and clinical decisions. But what we are talking here in patient doctor relationship and connection, it's something else that should be on top of this. They should also, this is why I put emphasis on this, because all the technology, all the skill set, we are bringing tools to help them. They just need to understand that, because this is something that is not a technology that is helping, is a human emotional connection.
And also it's the patient, so we need to understand what is the need. A lot of patients, because of social media, are asking for quicker and faster solutions. And I've seen all kinds of innovation of surgical intervention to have quick orthodontics done. What do you think of that?
Well, the quick orthodontics is, as I said, it's about tooth movement. Sometimes you will manage with a quick tooth movement. Sometimes you need something more complex. And I give you an example. Sometimes you have a missing tooth, and you can close the space. It takes a long time, or you can just place an implant in the crown. And this is just a simple example that the patient needs to be involved in the decision when the situation is more or less the same in terms of final result. But sometimes we need to give the input of the patient and tell him, even though this patient comes to close a space because he doesn't want any dental implant, we say it's not reasonable because it will take 2 years and it this and that. Sometimes the patient wants to close this to wants the dental implant, and we say no, this is actually a situation clinically that we should avoid the dental implant here.
That's true.
So we recommend according to the clinical situation, but the patient is giving us the final
That's true. No, we were talking about decartilization, what they are doing.
Well,
there's so many names to it.
Yes, but this type of procedures, they vary from culture to culture as well. Because, for example, if you look two different examples in America, North and South. If you have a small issue with bone discrepancy, you go directly to orthodontic surgery. In Europe, people are more conservative. They want to avoid the surgery. So this is the decision of going for surgery or not. Sometimes it's a cultural thing. When we think about corticotomies or some kind of accelerated tooth movement, it's the same. Should we take some risk or not? Is the patient able to do it or not? As long as the patient understands, if it's in my mouth and they tell me we can achieve this result in 1 year, but if we do corticotomies, we do it in 6 months, maybe I say I go 1 year, because I know that maybe corticotomies is a surgery, there is a risk, maybe they touch the root, maybe
That's
some
right.
patients say I'm getting married in 6 months, I want this.
Oh, yeah.
So we need to
Balance
to
it.
balance and to give the options, to explain the benefits,
And the risk.
to understand biology deeply, to see, okay, this might make sense, this doesn't make sense. There is no one solution for all, definitely, and we go accordingly.
I think it's still the same thing about the fact that you need to understand science, understand biology, and then
Yes.
understand the patient needs before you make a standardized treatment
Yes.
protocol. And I think the early days of orthodontics, a lot of it was bicuspids extractions, Yeah, and a lot of people ended up with loss of 4 premolars and same kind of treatment.
I tell you something. This is cyclic. It goes, it's trendy. It goes in a way, in the other way. The profile, how the profile should look, what should be the impact. Extractions is good or bad according to the techniques in the market. Blah blah blah. There is always a need to understand deeply the literature, the biology, science, and to take a decision. Of course, extracting teeth in some situations is correct.
Yes.
Some situations is wrong, and some situations is gray zone. And this gray zone, it depends on many things. As long as the patient understands, and as long as we know that it's not mathematics.
Yep.
I can tell the patient, even sometimes I'm in doubt because it's not making a cephalometric tracing and taking a decision.
Yeah. Yeah.
It's sometimes I say, in this case, I would say that I go 60% non-extraction and 40% extraction, but I'm not sure. And I explain the patient, look, I'm not sure because there is no one else like you. So I might have a need of taking a more cautious decision. We start non-extraction because I'm always in time to extract.
Yes, that's right.
If we do the opposite,
you
that's
can't
it.
reverse that.
Say, oh my God, I shouldn't have done it. So we need to be humble and say, I don't know everything.
Yeah.
In some cases that we are like in the 50-50, I say, look, I'm going in the non-extraction direction. If I see in some moment that this is not the right decision, we might have to extract it. Okay. Patient will be happy because you are honest. You are in a safe zone and you will be able to take the right decision without having this feeling of I cannot go back.
Yeah.
So, and some patients I say, this is 90% extraction, let's do it now. Or this is non-extraction. You see, so it's a gray zone.
Yes.
And this gray zone comes from experience, from many things that, from the aesthetic concepts, what the persons are valuing. And so it's many things.
Yeah, I think that's the point, because a lot of people, a lot of younger dentists, when they talk to us about cases, they always want to know, why do we make the decision? But as you said, it's experience. And because there are so many factors, you just need to go down the list. Yeah,
and it's important for the young orthodontists, they can justify to themselves. They say, why I'm going to extract teeth here? Yeah. As long as they have an explanation to themselves, they can be on the safe zone. It's the same as everything that we do in an orthodontic appointment has good things and bad things, because it's physics. We want to push one tooth in one direction, we might lose anchorage in other direction. We want to close space, but we cannot have the teeth aligned. We need to go with a wire that is not good for closing space, but is good for alignment. So this is why we do step. We go, because we cannot take one decision, that's it.
Yeah.
So when we take decisions, we need to balance and say, what am I going to do now? In total is better than the bad things that I'm also doing at the moment. because
The pros and the cons.
because when we move a tooth, we are creating inflammation.
Yes.
So we are always doing a good thing
Yeah.
and a bad thing. So we need to, in our brain, what I'm doing, I'm putting this elastic has 80% good and 20% bad. Always.
Yeah. Yeah.
This is if you justify to yourself, you are in the right
I
way.
think for you to even admit that, it's a big thing, because all of us in dentists refuse to admit that whatever we do, we might be doing a lot of good, but we also cause harm in actual fact. And
Think about implants.
yes, the same
You say
thing.
like this, I'm gonna place an implant.
Yes.
I'm gonna have a surgery. There is
Yes.
a risk. I'm putting an artificial thing in the mouth.
Yep.
But what is the benefit? The person didn't have a tooth.
Yeah.
So
that's
you
right.
say it's better to have a tooth
Yep. Yep.
in this way.
Yeah.
Then, so when you justify whatever you do,
Yeah.
there is more beneficial things than the opposite.
Then
you
we're
are
okay.
going in the right direction.
That's true. That's true. I think we all need to spread that news to the
Yes.
younger ones, because I think most of the time it's just procedure,
Yes.
treatment, get this done, get the aligners. Okay, we owe a lot to our mentors, and I know you have good mentors as well. What are the best advice you've ever received from any of them? Or the one that has the deepest
Yeah, I
influence?
faced many good dentists in my career. I shared professional moments with them and social moments with them. From the professional moments, my learning was more than everything was watching. I was filtering what I
Learned. Yeah.
learned. So the big lessons come from the social.
Ah.
Okay, so how to manage things in life, because you see these superstars and when you get to know them, you realize that they are normal
Human beings.
people, human beings,
Yes.
and you learn a lot of lessons how to enjoy the journey, because it's not just about doing nice work. It's a combination of things, because our day has 24 hours like everyone.
Yes.
So what I was learning is that, you spend a lot of time doing things
Dentistry.
at work, dentistry. So
Yeah.
you need to have fun.
I love that one. We need to have fun.
We say working, having fun.
Yeah.
And having fun means collaborating with colleagues, means having patients happy,
Yeah.
means having our social life, our family happy, means all that. When one of these things are not working, everything collapses.
Yeah.
So this is the biggest lessons that I learned from the top dentists that I met along my career, is that they are normal people, that sometimes they compromise family and social from work and they regret. So I always keep this in mind. And I think this is the biggest lessons. All the rest in terms of teaching is how much you want to learn and how much you pay attention to what they say and do. Because especially for me, that I deal with people from different fields,
Yeah.
many times, even if they try to teach me, it's not so easy because I don't catch immediately the message. It takes time to start to understand because we see different things.
Yes. Yes. Because we're trained differently.
We are trained
Trained
totally different.
differently.
So they talk and I don't see the benefit. And they talk again, I don't see. Until one day I say, now I see. It takes time.
Yes.
So I would say that this is the best message for the young people is to think that they live once. If they decide to do dentistry, they should do it good, and do it good is not
Just about techniques.
not about techniques, and it's about lifestyle.
Yes.
Enjoying living, enjoying work, enjoying collaborating with other people, enjoying making patients happy, enjoying making podcasts. So all the things that are related to dentistry should be priority, not only one thing.
Yes.
Everything should be priority.
No, I think that's so important, especially nowadays. We see dentists, we are very lonely. Some of the dentists, they end up just
Yes.
doing their work, and we hear reports all the time that people commit suicide for no good reason and give up on their lives. And I think that's where you are building something that hopefully we're going to be
Yes,
able
and
to
we
create
see that
that.
these people that we are talking about suicide, and it's actually a high rate in dentistry. It might be for I keep thinking about this because sometimes these people are very successful professionally, so it doesn't make sense. But I think what I just mentioned, this combination of social, of happiness, making patient happy, of collaborating with people, not being alone in the profession.
Yeah.
All this together will make a normal dentist to wake up in the morning and say, how nice, I'm gonna work today.
Yes.
Okay, and we might come with some nice tools to help the dentist to follow this path.
Yeah, and also stay connected in the network. And
Yes,
I think
this is super important.
yeah,
The
and,
network.
it's so important that it's like today you're here in Malaysia. It's almost impossible, but this is what networks do, and
The world is very small
yeah, the world is very
and
small
is
now.
connected. We
Yeah.
just need to be aware of that.
That's right, and not to give up. I think in life we all go to pendulum. I always remember that part. We will go down the worst, and then it will still swing up regardless. And if we don't give up, and that there are people around,
Yeah,
we
and
should.
sometimes when you get tired of dentistry, means that something is wrong, or you are putting too much energy in something that you shouldn't. It's better to disconnect for a while, because this disconnection will make you realize that dentistry is amazing, and you will come back again
Yes.
with the different strengths. So it's also super important.
Yeah. No, I like that advice. Me too. I went through that.
Yeah, I did the same.
Wanted to quit dentistry, but here we
Yes.
are. What we do.
Yeah.
Yeah. Okay. Coming back to a little bit of public advocacy, just for the public side, you are in the specialty of moving teeth. Why do you think we need to move teeth? We never did this before. We never had the need to move teeth.
Well, we believe that and we know that nowadays, in the past, when I say in the past, many years ago, there was less crowding.
Yeah.
We have some explanations for that. We believe that the food that we were eating was harder, and with that we were actually destroying the contact point of the teeth and creating what we call the contact areas. So we gain more space. Also the jaws
Size,
they
evolution.
were different. So we expect to have more crowding. And having more crowding creates several problems. Problems as teeth functioning, problems of accumulating bacteria and allowing for the perio problems, and aesthetic problems. So this is the main reasons that we should use the powerful tools of tooth movement to improve the function, the aesthetics, all this in order to make the teeth long last and to make the smile look better.
Yeah, I think that's very important. It's getting back the function, getting back into occlusion, keeping it healthy, and making it last. Yeah, that's the part
the
that
most
a lot
important.
of people,
This is now is very trendy to talk about the life cycle.
Yes.
The tooth cycle. So we, as soon as we have a small carie, the tooth is compromised.
Yeah,
so we just need to keep it as much as we can before we lose it during our lifetime.
Yeah, we're living a lot longer too, because in those days we don't live as long, so it doesn't matter if you lose that tooth. Yeah. So the other thing, dentists sometimes advocate to be, no different from everyone. We are all the same. To the public, they think that we are all the same. Do you think that every dentist should do aligners now, given that aligners are put out as a tool for everyone?
This is the tendency, and somehow I agree with that until certain point. It's not it's not a problem a dentist to make an aligner treatment, because I don't even consider it as an aligner treatment. It's just a need for a final result. So if I am a restorative dentist and I need to reduce a space to make a correct restoration of a tooth, and I use the technology and I use the service of a company to use an aligner and to give to the patient for them to use until the space is closed, I see it's very okay. So the problem here is when the dentist cannot identify his limits. The problem here is the understanding of the limitations. This is the only thing that is hard to teach. Usually this is taught naturally because they try, they fail, and they say, I don't want to do this anymore. But this is the important thing, because what we call nowadays minor tooth movement, I can teach my assistant in one day
to teach
to do it. It's so basic concepts that we need to teach. You say you have a tooth rotated. How do you rotate the tooth to the correct position? First, you need space. You need to gain space. And after you rotate, it's simple things that every dentist should learn in the second year of the university. It doesn't matter, and nowadays with the companies providing services that are helping them to do that, I don't see any problem to let the clinicians, the dentists, to do tooth movement. The problem is when they have zero understanding of orthodontics itself, and they think that is everything easy. This is where we have to create the limit and say, okay, this is another topic. Okay.
I think that's a super hard one. It's so hard. But I'm so happy to hear from you that you actually think that it's a good thing to have aligners out there for all dentists, because it is a tool that is necessary.
Actually, as a good news for the dentist, there are more easy cases that they can do than the complicated. So they should not get in dark zones. They should leave this quiet and to work on the simple things. Not with the intention of doing tooth movement, but with the intention of using tooth movement to help their own clinical daily work. This is the thing, because now we see I'm a liner dentist, or no, they are dentists. They have goals as improving the smile of the person, improving the function. They might need tooth movement. Fine, they can use it. No problem, as long as they understand the biology, the basic things, why the tooth is moving, what you need to do for the tooth to move, and the limitations.
I think you're right. Rather than saying that you're just an aligner dentist, we are all the same. We are dentists that are supposed to be helping patients rather than prescribing a treatment. I think that's the main key message that we need to come across. What is the biggest misconception now in social media platform? Now that worries you the most?
What worries me the most in social platforms now is that the dentists, they are using the social media to promote their work to the patients. This is for me the biggest problem, because they are putting before and after miracle things for the patient to believe that they can do miracle things in order to get more patients. The platform should be helping dentists to help dentists. Because if dentists help dentists, all dentistry goes up, and the last beneficial is the patient. This is how it should be. But the problem is that because the patients have access to social platforms, they put energy on that, and they somehow mislead the general public. So this is for me the biggest problem.
I totally agree with you on that, and it is hard to sometimes explain why we shouldn't, and that everyone is doing it. So I think eventually some of the countries, the dental council do take actions, but a lot of countries don't.
But it's very difficult to control that.
It is true. So I think some are really good work, and some are really good dentists, but it's just, how do the patients differentiate which one is?
They cannot. They get misled because sometimes some very easy dental work has a huge impact on the patient, and sometimes a very difficult and nice work that is shown the patient they don't understand. So it should not be for the patients. I think this communication between dentist and dentist should be improved, and we will work on that.
Yes.
And the patient will naturally benefit from all this, because we improving this communication between clinicians, all dentistry goes up in quality.
Yeah. And I think that's what you envision to do as well. I can't wait for that to come out. How do you think this industry, kind of looking back into the future now, how do you think this industry of orthodontics, is there going to be a major change of major innovative stuff that's going to come up?
I think we have several problems happening at the same time. First of all, because of this trend of aligners taking advantage of the new technologies that are coming, the result of that is that some basic knowledge in orthodontics will not be taught anymore. So the new generation will not know how to do the old stuff. It's like, I would compare it to the mechanics, the car. So
you know, and the
all service, you go to the mechanics, they understand about engines and they fix problems. Now we have electric car, there is no engine. They replace parts. So if you have old car, you go to mechanics, they look at this and they don't know what to do. It's going to be something like that, because we will have less skilled people, manually skilled, to do good things in terms of tooth movement. But the direction is going to go aligners, definitely. The future, I think, it's going to be probably printed aligners, and what we see nowadays as the major thing and what differentiate brands is the software. But I believe in the future it will be resins for the printers. I think this is going to be what will differentiate between.
Yeah. Do you think that other than just the resin and the material, is the fact that we're putting more tools to some people that may not even understand how to do it, and everyone is treatment planning themselves? So that's also...
But the thing is that because the tools are limited in terms of aligners, it's a plastic that applies a force to a pressure to a tooth, is somehow limited. We need the orthodontist to think a lot in order to do the less wrong decisions. In the future, if we transform this plastic with some, let's say, functionalities, like more pressure in this area, less pressure in this area, more strength in this area, when we get to this point, we might, as a company, be able to provide an easier solution for everyone to go in this direction. This is how I see it. I don't know how close we are from this moment. Now I think we are in the very beginning, because we place a plastic in the mouth that we create some pressure areas, some retentive areas with attachments. We know some biomechanics about this arch shape aligner. This part is stronger, this part is weaker. But in the future, if we are able to print with a new technology in resins, an aligner that applies different type of strengths and forces according to the biology need for this patient, it will come. The dentist will be just dealing with the patient as a social part. Even this social part that requires the understanding to make the patient to use. In the future, maybe there will be a microchip on the aligner tracking if the patient used, when to use, at night, during the day. So all this is going to go.
It's so exciting.
I'm very excited because I think this is going to be the future. And the software that now is the main thing, it's going to go with the AI, and it will not need so much human thinking, because AI will take over and we cannot keep track on that.
That's true. Yeah. Right. What do you think, this podcast, we very much wanted to call it This Little Character. And this little character is Optimist.
Optimist.
Yes, and this is a gift for you.
Thank you.
It has make every day a little bit more joyful, and that's what we want to do with this podcast. That
Thank you so
Dentistry,
much.
we want to make every day a little bit more joyful, especially today where we have orthodontics. We want to make one of our dentists or any of one that's listening to this joyful, seeing hope and optimism into what we have in life. So this is not a toy. And they created it in 1960s, actually in the 68, basically to make everyone happy in a very, very difficult time. And I think nowadays with dentistry, we are also experiencing that with technology and everything changing. We dentists are getting all confused of what we need to do. And that's why we started this podcast.
This is a good reminder. I will put it in my clinic. Every day I go to work, I look at it and I will remember this nice moment.
Yeah, and it bounces. So
okay, great.
Thank you so much
Thank
for
you very
coming.
much.
And thank you for sharing all your tips and what you think.
My pleasure. Thank you very
and
much.
you'll be back again because we have lots of projects going on. And,
Yes,
and,
let's do
and
it.
we're going to be talking about them.
Thank
Yeah.
you. Thank you very much. Thank
Bye.
you.
Thank you.
Bye-bye.
Bye.